have the plans B through H to look at, and I hope you got handouts when you came in for your particular group. And then when Peg is done, she's also gonna go through the HSA and just kind of do a review of everything so that everybody understands what these plans are. Then we have Dawson Lorimer here from HRA Viva. Some of you are participating, have it's called a health reimbursement arrangement. And there's been some changes as a result of the health reform. She's going to go and explain that to you. And just feel free to, raise your hand, ask questions. We want to make sure that you walk away from here knowing, what's happening for the plan year 2013. Thank you.
Okay, do I really have to use this microphone? Do I really? Yes, I really do. He's going to make me. Okay. Okay, well, thank you all for coming today on such a beautiful day. We'll try to get through all of this as quickly as possible, but Chelsea is absolutely correct. Any questions that you have, we are here to answer them. And if it's not something that we can give you an answer today for, we will get you an answer. So I've got a nice big sheet of paper up here to write down your question. Or if there's something that you have that is specific to your situation, you want to talk about a claim, or you have a question about a provider or something that's really, personal and specific to you, I will be here afterwards, and my information is also on the website. So it's phoniak@questoffice.net, and I'm happy to take emails if you have a question after today. Okay? So I'm going to go through some materials, but let's start with kind of a visual. And this is, if you were here last year, you'll go, I remember this, but this is a refresher. You really have kind of three different pieces to it. You've got the insurance piece that's provided through the OEB vehicle, and those the insurance is through ODS, which is now changing their name to Moda Health. So if you see something Moda Health and ODS is the same, it's not a carrier change, it's just a change of name. So there's the insurance pieces, and as Chelsea mentioned, the plans that we have to choose from this year are from B through H, and we're going to talk about those. And then there's the two other pieces, which I'll call the vehicles. One is the health savings account, and there is the health reimbursement account. So just so that Dawson and I can have an idea, how many folks here are on an HSA right now? Okay, several of you. And how many of you are opting out and are on the HRA? Okay, couple. Okay, all right. So if you think about it this way, if you want to do the least amount of thinking about it, you're going to pick one of the non-HSA, non-HRA vehicles, because I just want insurance and I really don't want to have to do too much thinking about it. There's a deductible and there's co-insurance, and I know that if something catastrophic happens, I'm going to have this insurance. That's one option. The other two options, the HSA is a vehicle that has to be attached to one of the plans, and I'm going to get into the specific details of that, but it has to be attached to, formerly called ODS Plan 9, now it's going to be called Moda Health Plan H. And the idea is that when they were implemented it was to engage the consumer more in what we're spending. I am personally on an HSA, so I know the experience is that as soon as you get the first bill from the doctor, the hospital, whomever, you're actually looking at it because you think about it, this is the money that's in my account that is going to now be paying this. So it's kind of a different thing. I'm going to go into details about that, but that's kind of what that's for, the health savings account. And while it's something that you can switch on and off, so you can decide, maybe you decided it wasn't for you last year, it might be for you this year, but I would say think of it as kind of a longer, broad goal is to save for your health expenses down the road with the health savings account. The health reimbursement account, which is the one that Dawson's going to go into great detail on, is if you're opting out of coverage and you want to set those dollars that are available by virtue of the fact that you're opting out aside for expenses down the road. So they're really, as I talk about them, you might say, well, I'm not interested in opting out, so you can kind of tune out when we talk about that. But if you never considered opting out because you have other coverage, you might want to think about it. Or back to the HSA, non-HSA. Okay, it's a fresh new year. You'll have the opportunity starting October 1st. Okay? So the first thing I think I'm going to do is talk about some details on the health savings account, because that's, before you get into the insurance side by side, and Sharon did a fabulous job of getting this all on one page. I know the font's small, but even I can read it, and it's colorful. So it's easy to read. So we are going to go through that, but let's talk about the concept first. Okay, so the concept of the health savings account is, again, one that started years ago with the idea that maybe if we were all engaged in what our health dollars were spending, we would be better consumers of them. That was kind of the idea. And if you've been on a flexible spending account, a Section 125 plan, you know that the thing we always think about with that one is, well, I don't want to set money aside because what if I don't use it all? Because there's that thing that you've all heard about, the use it or lose it with the Section 125. Well, the HSA takes away that use it or lose it piece. So it just says that you can set money aside and it comes out of your check on a pre-tax basis and it goes into your account. But with an HSA, the differences are several. But the biggest one is that there is no use it or lose it. It sits in your account until you decide to use it. And it doesn't have to be for an expense that you incur this year. You can build up money for expenses that you may incur in 10 years. The account is something that is separate from the insurance. So on a health savings account, there's really two pieces to it. There's the insurance piece, which I will talk about, and then there's the account piece. So the insurance piece, you don't have to do anything other than go into MyoWeb and sign up for the plan, formerly 9 is going to be Plan H. You go on to the insurance plan. That's the piece that the insurance is set up by the district. The premium is paid for by the district. You don't have to do anything besides enroll. Over here is the part you do have to do something about, and that is setting up the account, setting up the health savings account, which is where you make your own selection. You are not required to pick any particular financial institution. You can go to a bank, you can go to a credit union. There are institutions that just do health savings account. The biggest one is probably HSA Bank, and that's all they do. And it's an internet bank, but it's specific to what the needs are of health savings account owners. So you go to the financial institution. I personally have mine at OSU Federal Credit Union. Because we have other accounts there, they waive the fees. Some financial institutions will charge a fee, some don't. It's something, again, your responsibility. So insurance, district responsibility once you enroll. Over here, the account, that's your responsibility. So you set it up, and then the amount that goes into that account every month is going to fluctuate based on where you are and which employee classification you're in. So I know that, Sharon, I believe you've handed out what's available if you're on the HSA, what part goes into the account. Yes. So if you picked up one of those, you'll see that there's money left over. What that just says is by picking a high deductible health plan, HSA compatible, there's money left over at the end of the month. And that money then is deposited to where you want it to be deposited for your use at a later date. So on a health savings account, there are some things to keep in mind. It's great because you have this money going in there. Awesome, I'm going to own it, it's mine. If you leave Lincoln County School District, you take it with you. If you go on it this year and you don't want to be on it next year, it's still yours. It is your account, it's in your name. It's attached to you as a taxpayer. So I'll use myself as an example. My family is on an HSA. It is in my name as the taxpayer, but my husband and son are on it also. So we are able to put aside then the amount, and I'm going to now refer to the health savings account FAQ, and you'll see on there for the 2013 health plan year that the most we can as a family contribute is $6,450. So that could be some employer funds, some employee funds. So say that the district, whatever you have left over, we'll just round figures. I know it's not going to equate to anything you have that you're all looking at. You're all looking at something different. So let's say you have $1,000 left over. That means that you, as a family, could also put into your account $5,450 in 2013, and in 2014 that goes up to $6,550. So that's a money that is going into your account pre-tax to pay for the same things that you use a flexible spending account for, which are unreimbursed medical, dental, or vision. So think of the things that you have: deductibles, co-insurance, pharmacy, vision, dental. All those things, just as they are eligible for a flexible spending account, are eligible through the health savings account. The same list. It's the exact same IRS list. It just says that when I get my explanation of benefits from my insurance company, I can see that it went toward my deductible, and I can then go to OSU Federal and withdraw the money to reimburse myself, or I can just leave the money there and save it for a later expense. It's totally up to me. You can go back and forth between submitting for reimbursement or not, or you can submit everything you get for reimbursement. But it's going to look and see how much is in your account, and that is how much you can be reimbursed. So as you think about it, and now I'm going to start referring to this number, because on the right-hand side, the very furthest right over, you'll see where it says Plan H. Plan H, as you can see, has a $1,500 individual deductible. But if you're on it like my family is, it reverts to the $3,000 family deductible. So before the insurance really kicks on in, and there's a couple of exceptions which I'll mention in a moment, I have to incur and I have to pay for the first $3,000 on this plan before my insurance kicks in. Okay, so that is something to really think about, because on a health savings account, yes, you think, oh, I've got this fund, it's growing, this is going to be great saving for our retirement. That's all well and good, but you have to think about, okay, well, if October 1st I get sick, I have an accident, I'm going to be subject to this deductible. So as I'm talking about it, think about that. The other thing that is worth mentioning, and again, it's all on this FAQ that we handed out, is that to be on a health savings account, not only do you have to be on a HSA compatible plan, which in this case is Plan H, but you can't be covered under other non-HSA insurance. So you couldn't, say, be on your spouse's plan that has a $500 deductible in this, and you think, well, I could put money aside and just run everything through my spouse's coverage. You can't do that by IRS guidelines. You can't be Medicare eligible, and you can't be claimed as anyone else's dependent. Again, it's all in the FAQ. But the biggest thing to think about is I can't have other insurance, and I have to meet that deductible. So those are the two things I want you to think about as to whether or not you're a candidate for the health savings account. So you can see it's a pretty vanilla plan. Once you meet the deductible, as long as you're going to a participating provider, it's paid at 80%. So for those of us that have been doing this for 30-some years, it's what it used to be, which is, the first deductible is what you, the insured, pays for. And then the balances are going to be paid at 80% by the insurance and 20% by you until you get to the out-of-pocket maximum. And you'll see on this plan, the out-of-pocket maximum is $5,000 for an individual, $10,000 for family. So as you think about it, it's a lot of money, but think about, okay, but while I'm doing that, my account's over here growing. And it's growing to offset those expenses. So, and here comes the two exceptions to the plan. One is preventive services. By virtue of the healthcare reform, preventive services on any of the plans that you pick here, any of the one, is going to be paid at 100%. So scheduled preventive services paid at 100%, whether you're on the HSA or on the $350 deductible plan. So those aren't even going to be things that tap into your HSA or go towards your deductible because they're paid in full. So keep that in mind. The other thing on the HSA is that there's a pharmacy piece. The value pharmacy is going to be subject to a small copayment instead of the deductible. Okay? So those are two things that won't go to the deductible, but every everything else, and I can't say that too much because you really need to understand. I'm not trying to scare you from it. I'm on one. I love HSAs. They're a great vehicle for people who really think it through, but it's certainly not for everyone. You have got to think it through as a part of a long-term strategy for you and your family. Okay? So under this plan, the other thing to keep in mind, and if you go to the website, you can see we've done some analysis on the different scenarios of claims. If I had this amount of claims, which plan would have been better off on? Those are all on the Lincoln County School District website for you to look at. But the thing that's great about the HSA plans is while everything does go to the deductible, everything does go to the deductible. So you'll see if you're on one of the other ODS plans now, you know there's things that don't go to the deductible. Every time you make an office copayment, if you go to the emergency room, those flat dollar copayments do not go to your out-of-pocket maximum. So depending on what it is that what claims you incur, you might you are in most cases going to be better off at the end of the year when you look at what part is going into my account to reimburse me and what part am I paying for claims by being on the HSA plan. Okay? Questions about the HSA? Yes?
So now, last time, pharmaceuticals went towards the deductible with your HSA. Are you now saying that is not the case?
So did everyone hear that question? What about pharmaceuticals? So it's the same. The only one that there's a small strip of pharmacies that are for 6 conditions that are in the value tier, that those are not subject to the deductible. Everything else, I would say in your mind, if you want to think about it in the best manner, everything goes to deductible, including the pharmacy. There's a few things that don't and that you won't have a deductible on. But I would think you would be best off to think of any pharmacy that I am taking is going to be subject to deductible, and therefore I'm going to be paying for it out of my pocket. Okay?
So it is going, you're saying it still is going towards the
Yes.
deductible?
Yes. There's a few exceptions. Those things that are on the value tier. Other questions? Yes.
So, my husband has insurance, and we have 2 kids.
Mhm.
If I went on the HSA and the Plan H, but my kids stayed on my husband's insurance, can I use that HSA money to pay for any of their medical expenses?
Yes. So did everyone hear that question? So can I use it? Yes, you can use, as long as they are just with like the flexible spending account, you can run their expenses even if they're not on your insurance. You can, as long as they're your tax deduction. So again, I'll use myself as an example. I have a stepdaughter who, her mom claims her as a deduction, so we cannot run her expenses through our health savings account. But as long as they're your deduction, absolutely. Okay? Other questions? Okay. So, and I'll be here if you have questions that come up on the HSA, or as we go down the road, you think of something, just take us back because it's probably a question everybody else has. The next thing I'm going to go through is there's a 2-3 page bullet point sheet here that I tried to synthesize down the changes on the ODS, soon to be MODA health plans, so that we can kind of work through these as you consider which plan's best for you. So I'm just going to go through this, and I'm going to kind of read it to you because this is really also my cheat sheet just to make sure I kind of expand on these items. The first thing is that there is really no connection from like Plan 1 to Plan A, Plan 2 to Plan B. I mean, you really can't do it across, so that's because they have really changed these plans in a couple of different in different fashions. So they're really, ODS is now really, and OEB is calling them A through H. Okay, so there's no longer the 1 through 9, it's A through H, and again, don't make the direct connection because they're really not. Yes?
So, if I've had an HSA currently and my prescriptions, I have, a card through Oregon. So if I really don't pay that much for my prescriptions, is that gonna change now? Is that what you're telling me?
No, it's not. The only change, and it's really not a change because it was that same way last year. Anything on the value tier, which is again, if it's those six, I think there's 6 chronic conditions, and but it's only there's certain meds. I mean, that piece is not changing, and there's just not. It's not a change. Everything else is subject to the deductible. But if you're paying a little bit, it's probably one of those things that's in the value tier.
Okay,
My
so
guess.
if we shouldn't see a change
If you're on Plan 9, it'll just be you need to re-enroll and on Plan H, and it will the pharmacy benefit has not changed on the Plan 9, right? Okay, so I'm just listing out here what the deductibles are because you'll see, and this is the first thing is we've never had a $350 deductible before, but we do now. Well, we will in October. So you can see Plan B is a $350, Plan C is $500. So we've really got everything between $350 and $1,500. The one thing I'll point out here is that the Plan H is the only one that's HSA compatible, and that's part of the IRS regulations, again, that it has to be paired, to be on an account, to have a health savings account, you have to be on an HSA compatible insurance plan. And the only one that fits that bill is Plan H, okay? And the other thing I'll point out there is, and we are not sure exactly how they're going to verify it, but OWEB has told us that you as an individual are going to need to verify that you have set up your health savings account. So it's not meant for that you just want a high deductible health plan. If you want that, moving forward, that's going to be Plan G. But if you want the high deductible health plan that goes with an HSA, you have to pick Plan H. Okay? Okay. So and the next change is really on the pharmacy. So this is all the plans A through G. So not H, because we've already talked about that being different, but plans B through G that you're going to have choices for. On the value tier, you'll see that's the first bullet item we just talked about. Those six conditions. They're going to waive that $4 copayment starting October 1st. So if you've been paying $4 for value tier starting October 1st, that is going to go away. The next difference, and this is probably the biggest change, is that the pharmacy piece on plans B through G will no longer have an out-of-pocket maximum. What they're changing to is a maximum copayment. So I gave you some examples here. So the first bullet point you could see that I said is preferred copayment is 25% to a maximum of $50 for a 31-day supply. So that will be a change in that their idea was, or at least how they sold it to us at the meeting, was that you'll be paying less up front. But the thing is that those co-payments don't go toward the out-of-pocket max. You don't have, they will go on forever. And if you're taking 15 medications, you're going to be paying $50 per each of them if they're preferred, or if it's non-preferred, it's $100. So potentially, it just depends on where you fit, but I really want to make sure people understand that that's probably the biggest change moving forward. And that's a big part of why the rate increase is so small, because this is going to affect a lot of people. So just think about it, there's no longer a cap, that once you're done paying those co-payments, you're done for pharmacy for the year. It will just be a cap each time you go in, and that's per prescription. So, and using that as an example, you'll pay 25% to a max of $50 for preferred. If you're using mail order, it is going to be $100, okay? Let's see, other things to mention. Oh, I already mentioned the pharmacy plan for Plan H is that it's subject to the deductible except for the value tier. I already mentioned that you're going to have to set up the HSA. The next thing I want to mention is the systems of care. So You may or may not remember last year we talked about one of the options under ODS as being that there were things called medical homes. Does anyone remember at all? I mean, if you went out and looked on the OEB website, there was reference to medical homes. Well, what they've done is they've embedded the medical home concept into all of the plans. And so I gave you the sheet that's attached to it is, this was actually from the OEB presentation that they did, because I thought it did a good job of making a visual of this. So the medical home is now called systems of care. And what that's just saying that you will have a co-payment if you go to these systems of care. And the systems of care are throughout Oregon. And I will tell you here on the coast, it's Samaritan Health is going to be part of the systems of care. And this is starting October 1st. I'm sure that, there's providers outside of Samaritan, but the one big one I wanted to check on so that we could tell you that you will have providers that fall into the system of care. So Samaritan will be part of that. So you can see what that means for, let's look at the incentive in chronic. So the second line down, you'll see that if you go to someone who is in the system of care, it's going to be, if you're on plan, we'll say plan B, it's a $10 copayment. Okay, but if you go outside of the system of care, but it's someone who's PPO, it's no deductible, but you're going to pay the coinsurance. And the other option is, I don't want to go to systems of care, I don't want to go to PPO, I want to go to somebody totally else, it's deductible and coinsurance. So it's built in to each one of the plans, and it just gives you some, depending on what you're going in for, certainly flexibility. You can go to any provider that you want. It's just you're going to get the best benefit whenever you use the systems of care. Yes?
So when you're saying co-insurance, you're meaning co-pays? No?
Well, it depends. If you're in the systems of care, it's a co-payment, which is a flat dollar. So you can see back to the incentive chronic line. Under systems of care, it shows it's a $10 copayment for plans A through C. But if you do that same thing, you're in that, I need an incentive chronic office visit, and I'm not in my system of care, I'm just going to a PPO doctor, it's going to be not subject to deductible, but coinsurance, which is the 20% or the 30%. So it's the percentage, okay? So you could see that it then changes. Primary care also, it's a copayment. So if you want to think about it this way, is that the only way you're going to have a copayment now is if you use the systems of care. So they threw out the narrow provider list. They've kind of done it a different way in that they've added this to all the plans. So you really have ultimate flexibility. It is kind of confusing. Is it making sense the way I said it? Okay. So, so that was the big thing that I wanted to make sure that I explained that and showed you the visual of that. So the last thing I want to point out, before we take any more questions that you might have and or get Dawson up here to talk about the HRA, is that there is a mandatory re-enrollment this year. And I cannot stress this enough, because if you don't enroll in my OEB within a timely fashion, your benefits will cease on September 30th. I mean, it's in the materials. That's what they said. They're just going to flip the big switch, and you will no longer have insurance if you do not go in. So you have to go in to do enrollment. And I don't know, have we talked about doing some incentives this year, Chelsea? Maybe?
We haven't talked about it yet.
So maybe, we'll see. But the incentive is you want your insurance, make sure you go and enroll. That's a big incentive. So that is kind of the presentation. Other questions that you have about the insurance? Yes.
So if you have an HSA, this little thing doesn't really apply to you at all. You can pretty much go to anyone because it's all going to go towards your deductible.
Right.
So what happens once your deductible's met, then you're just gonna have your 20% or whatever.
Right, right.
This
So
doesn't pertain if you have
this,
something
so the
that's-
question is, what about, how does this pertain to the HSA? It does not. But the one thing I'll point out is under the HSA is that you're still always going to get the best benefit when you go to someone who's participating on the plan. Because you can see there's 2 categories for each one of these plans. Under the HSA is no different. If you go to someone who is on the PPO network, you're going to get an 80% benefit, where if you're going out of network, it's going to be a 50%.
But the systems of care doesn't really
Right.
pertain.
The systems of care does not
That's-
pertain.
yeah, that's
Yes,
what I meant. Okay,
absolutely.
perfect.
Other questions? Okay, yes.
You keep talking, who is funding this HSA account?
So the funding of the HSA, if you picked up one of the sheets, because it's the fund is different depending on whether you're classified, licensed, certified, or administrative, as to how much is available. But it's really whatever your cap is minus what you're spending on the insurance. The leftover
Yeah.
is what's going into the health savings account. Okay? Yes.
On the annual deductible thing, it says family equals 3 times individual. Family or individual is $500. Down below that, I'm on Plan C, and down below it says 2,600. Why is that?
Because that is, so the 500 is the deductible. So that's the part that you have to, meet. Okay. The part below it is the out-of-pocket maximum. So that just says in a catastrophic, right. Other questions? Yes.
You already have the health savings account
Mm-hmm.
with your bank all set up, that's all taken care of, that'll carry over year to year, you don't have to redo anything with your bank.
That's correct. So nothing to do with your HSA if you have it. You just need to go into MyOEB and enroll. Okay? Yes.
Will it be posted online, who fits within systems of care, PPO?
Yes, about the systems of care. It will be, it is not on ODS's website right now, but I did that, I had to email them and say, okay, where is this? It's forthcoming, but the one I asked them specifically about was Samaritan. It might be up, this was last week, so you might look and or give them a call. Okay, yes?
On the comparison sheet for the Plan H, it says 1,500 individual, 3,000 family deductible. But on the questions, it says a minimum deductible 1,250 and 2,500, and the out-of-pocket is also.
Okay, well, this FAQ is the IRS guidelines. I use this for all my groups that have HSAs.